Oh, thanks very much to Health Services Research UK for inviting me to make this conference presentation, and to you for listening in. You're here today to hear about the systematic review we've done about the effect of social norms interventions on clinical behaviour change. We've defined social norms interventions as those that aim to induce change in the clinical behaviour of a target health worker by exposing them to the values, beliefs, attitudes or behaviours of a reference group or person. And there's 5 behaviour change techniques that we've identified that could be classified as social norms, and those are all listed there. Social comparison, information about others' approval, credible source, social reward, and social incentive. And these behaviour change techniques are all listed in a taxonomy that you'll all be familiar with, I'm sure, the behaviour change technique taxonomy. Now these 5 behaviour change techniques aren't clustered together as social norms in that taxonomy. That's something that we've brought together because social norms we feel are an important topic to study and something that's frequently used within the NHS, but they're not grouped together in that way currently in the taxonomy. So to give you some examples of what's the social norm behaviour change technique, a couple of examples here. The first one from Holsworth et al. Was a letter to GPs who were highlighted as being amongst the highest prescribers of antibiotics, and they got a letter from the England's Chief Medical Officer, which was the credible source, and the letter told them that their practice was prescribing antibiotics at a higher rate than many of the other practices in the local area, which is a social comparison. And then the other study that I'll highlight today is by Triyesh, and it's this is looking at social comparison. So doctors were sent graphs like this, which show the number of tests that they prescribe, that they are ordering, shown in light blue, compared to the number of tests ordered by other doctors in their practice group or region to try and influence their behaviour. So the research questions in our review is looking firstly at what's the overall effect of social norms interventions, both on clinical behaviour of health workers, but also on the outcomes for patients that might result from that. But also we're interested in which of those social norms behaviour change techniques are particularly effective, whether some are more effective than others, and we're thinking which contexts and what types of mode of delivery make social norms interventions more effective. The inclusion criteria for our study were any papers that dealt with health workers, that looked at a social norms intervention, where they were carried out in healthcare settings as opposed to simulated settings or academic settings, that kind of thing, and where the studies were randomized control trials, and the details of our methods are published in this protocol. So the analysis, for the analysis, our outcome was the closest outcome to 6 months after randomization. We had multiple different kinds of outcomes because it could be, for example, the outcome might be ordering of a test, or giving a prescription, or hand washing, or lots of different kinds of behaviours, and we had to convert all of those to a standardised mean difference, which we did using statistical methods. And all of our trials, many of them were cluster trials, so we adjusted for clustering. Our first we used a mixture of different kinds of analysis, including fixed effects meta-analysis, meta-regression and network meta-analysis. And we undertook some sensitivity analyses to take account of studies that were high risk of bias or where the data had been incomplete. So this is our Prisma diagram. We searched 7 databases, and resulting from that we had about 4,500 studies that we looked at the titles and abstract of to screen out any that were clearly irrelevant, and then there were 477 that we looked at the full text. We ended up with 106 trials that had useful outcome data, and from those there were 117 useful comparisons because some trials had more than one arm. So what's the overall effect? We found that social norms interventions do have a small positive effect on behaviour. On health worker behaviour, we found a standardised mean difference of 0.08. That was based on 100 comparisons. And in terms of patient outcomes, we found a standardised mean difference of 0.17 based on 14 studies. Massive amount of heterogeneity. Lots of different studies here, lots of different kind of clinical populations, different behaviours. So we certainly found a lot of heterogeneity in our results. As well as the fixed effects, we did random effects meta-analysis and found very similar effects. And our results were robust too when we excluded studies at high risk of bias or with imputed data. Just to illustrate what that standardized mean difference means, it's the equivalent in a binary outcome to a difference of 4 percentage points, where if, for example, the control group had 40% of people doing something and the social norms intervention had 44% of health workers doing something. So we've seen that social norms interventions are effective on average in changing behaviour, but we're interested in which of the social norms behaviour change techniques were most effective. So we found in our study examples of social comparison, credible source and social reward. The other 3 behaviour change techniques that we identified actually didn't appear in our review because there weren't any studies that used them exclusively. So social comparison was the intervention that we saw most frequently. As you can see, that tended to be effective whether it was used alone or with other behaviour change techniques. I'd like to highlight here that it was particularly effective here when used with prompts and cues. You can see there's an effect size of 0.33 there based on 5 studies. So that does seem something that's worth further investigation, is using social comparison with prompts and cues. But I should emphasise that on the whole it did seem to work with most other kinds of behaviour change techniques too. Credible source we found in 15 studies, and that was shown to be effective either alone or with as used as part of other complex interventions, and it was also effective when used with social comparison. Social reward we only found in 2 studies where we found it not to be an effective method, although as you'll see up above, when social comparison was combined with social reward, it does seem to have been effective. So rather a confusing picture there on social reward. There were some studies that used multiple social comparisons, a number of the different ones together, 3 or more together. That was in 4 studies, and those were shown to be effective. We were interested in which contexts social norms interventions work. This slide summarises that. It shows a number of different contexts, and the brackets are the number of studies that tested those contexts. Any that are in green, that there's evidence, positive evidence that social norms were effective in those contexts. As you can see, generally social norms worked across with doctors, with other health professionals, with all different kinds of behaviour, and in primary care and in hospital settings. It also worked whether the intention was to reduce the behaviour or increase the behaviour. There were some contexts where we didn't find any evidence of an effect, but as you'll see, generally those were fairly small numbers of studies, so it's hard to make any definite conclusions that social norms weren't effective in those particular contexts. In terms of mode of delivery, social norms seem to have been effective from a number of different kinds of sources of the intervention, and whether it was internal within the same organisation or external. It also worked on a variety of different formats in terms of email, written, via the web and mixed, although it doesn't appear to have been effective in terms of face-to-face. In terms of frequency, the social norms interventions were effective whether they were delivered just once or whether they were delivered more than once. But on average, it did seem that it was more effective, strangely enough, when it was only delivered once. And we're not quite sure that's not particularly consistent with past results. It's plausible that it's actually the times when it's delivered more frequently are when the behaviour is more intransigent, and that finding may also possibly happen to face, but I'm speculating slightly there. So in terms of conclusions, there are lots of heterogeneity in our review, as we might have expected in this context, but on average we found that social norms do have a small effect on healthcare professional behaviour and also on health outcomes. Social comparison was effective whether on its own or combined with other BCTs, and it seemed to be particularly effective when presented with prompts and cues. Providing approval from a credible source is effective. It's not used as much as social comparison, and it does seem to be an intervention that warrants greater use within the NHS. And we found that social norms work across a wide variety of NHS contracts, so could be recommended for all different sorts of settings. Thank you very much for listening today. As it says here, if you have any questions or comments, please add them, and we will read them and respond to you. If you need more information about it, you can check out our website. Thank you.